So I would now like to introduce our keynote speaker, who happens to be someone I know personally and greatly admire, so I'm really glad he's here tonight, Dr. Kheriaty. I'll tell you a little bit about him. He's an associate professor for psychiatry at the UC Irvine School of Medicine, and also is the director of the medical ethics program for UCI Health. He also serves as chairman for the medical ethics committees at UCI Medical Center and the California Department of State Hospitals. Dr. Kheriaty graduated from the University of Notre Dame in philosophy and pre-medical sciences. He earned his MD degree from Georgetown University and completed residency here at UCI in psychiatry. He has authored multiple books and articles for professional and lay audiences on bioethics, social science, psychiatry, and religion. His work has been published in the Wall Street Journal, the Washington Post, Public Discourse, and First Things. He has conducted print, radio, and television interviews on bioethic topics with the New York Times, the Los Angeles Times, CNN, Fox, and NPR. On matters of public policy and healthcare, he has addressed the California Medical Association and has testified before the California State Health Committee. He is a senior fellow and director of the program in health and human flourishing at the Zeifer Institute in Palo Alto and a scholar at the Paul Ramsey Institute in San Francisco. Please join me in welcoming Dr. Kheriaty to the podium.
Thank you, Dr. Lee Buckland, for that very kind and generous introduction. A student once asked the famous anthropologist Margaret Mead a fascinating question. What is the earliest sign of human civilization you've discovered? The student expected her to say something like a piece of pottery or perhaps a fragment of a handheld tool. But Mead replied that the first sign of human civilization was a healed femur, a 15,000-year-old human thigh bone. In a primitive hunter-gatherer society, a person with a broken leg would have absolutely nothing to contribute to the functioning of the community. He was a drain on the collective resources. After the bone was set, and while it healed, this person would have to be carried around from place to place, fed, sheltered, and tended to for many months. And yet, this person did live long enough for the broken bone to heal. And this means that he was cared for by the community at considerable cost and at some risk to the welfare of the others. It's encouraging, I think, to consider that the compassionate practice of medicine, this ancient profession dedicated to healing the sick, signals the dawn of human civilization. My friends, this is a very great enterprise that you're embarking upon today. So full disclosure right up front, I don't think this is going to surprise any of you. Medical school is a challenging path. Few careers require this much schooling. When you receive your medical degree, you'll graduate from at least the 20th grade. And then there's residency and perhaps fellowship training. While you're here, you will digest enormous amounts of information in the first 2 years. Then you'll experience a steep learning curve as you acclimate on the wards during the second 2 years. Some days are going to be difficult. To be honest, there were times as a medical student when I considered finding another career path. But like me, you'll navigate these challenges. And when you finish, you'll look back with no regrets. I promise also that medical school is going to be a thrilling ride. Your hands will tremble as you perform your first lumbar puncture. Your heart will skip a beat as you wait with a woman in labor to deliver your first baby. You'll make some rookie mistakes on the wards, and you'll hope that the residents and the attendings, not to mention the patients, don't notice. But in the end, each of you will thrive here. Practicing medicine will change you, as it changes all physicians. Becoming a physician is kind of like becoming a new parent. It alters you permanently. And I think the practice of medicine shapes your identity mostly for this simple reason. Your patients become part of who you are. Your own happiness and success will no longer be a kind of separate project, standing somehow apart from your patients' well-being. Their lives become intertwined with yours. Physicians deal with tremendous suffering every day, and you're soon going to be thrown into the charged, complicated, and often anguishing center of your patients' lives. More than any textbook, more than your professors in medical school, more than your mentors in residency, your patients will be your best teachers. They'll teach you lessons about suffering, and about resilience, and about hope. And if you let them, they'll change you for the better. As medical students, you'll be granted many extraordinary privileges. In fact, you'll be allowed to do things that in any other context would be considered a felony, like dissecting a dead body. You'll be permitted to practice unperfected procedural skills on patients. And later, as a physician, you'll be granted a monopoly on other privileges, like prescribing and ordering diagnostic tests and performing procedures, or doing surgery. You're going to be granted these privileges not primarily because of your own personal merit. These things are not first and foremost for us. Likewise, none of the great sort of apparatus of modern medicine, the hospitals, the MRI scanners, the surgical robots, the powerful medications, the vast sums of money spent on the whole enterprise, none of this exists primarily for the sake of medical students or physicians. At the end of the day, medicine is always and only about our patients. That woman lying there in the hospital bed, that child anxiously, nervously walking into the clinic, that man who's awaiting his test results, afraid of what it might show. That's why we're here, my friends. These patients will tell you things in confidence that they've never told another soul. They will entrust their lives to you. To become worthy of this trust and to remain always loyal to this trust should be the aspiration of every student who dons the doctor's white coat. Keep in mind that this trust needs to be earned. Doctors are held to a higher ethical standard than any other profession. As just one cautionary tale, consider the neurology resident from Miami who was recently caught on film yelling at her Uber driver while drunk. The video went viral and she lost her position. Our professional standards do not dissipate when we leave the hospital. Society expects that physicians will be women and men of integrity, and our patients deserve nothing less. While I'm grateful for all of modern medicine's amazing technological advances, technology is not at the heart of medicine. At the heart of medicine is a human relationship. Our profession is grounded in the relationship between a patient who suffers illness and a physician who pledges to use his or her powers to heal. The patient is vulnerable because of the illness, and he or she enters only reluctantly into this relationship. We must remain mindful of our considerable power and our immense responsibility. In modern usage, we've become accustomed to calling just about any occupation a profession, but in the ancient and medieval world, this wasn't so. The term profession was originally used to designate just three occupations: medicine, law, and the priesthood. What all three of these had in common was a particular kind of relationship: the doctor-patient relationship, the lawyer-client relationship, or the priest-penitent relationship. In each of these relationships, one member was vulnerable, and the other member promised the assistance that they needed: healing, or legal counsel, or spiritual care. Great harm could come to individuals if these professionals abuse their power or privilege. So to help gain the public's trust, these professionals developed the ancient tradition of taking a public oath. Prior to engaging in their work, they made a solemn and binding promise. They were professionals precisely because they professed this oath. What physicians professed was, of course, the Hippocratic Oath, and today we maintain this tradition with our contemporary oath. With this promise, we pledge to use our learning and our abilities always and only to heal the sick patient. We likewise promise to minimize harm, to maintain confidentiality, and to stringently avoid exploiting the patient or abusing our position. And by this promise, we also become members of a collective moral community of physicians who are responsible to hold one another accountable to these high ideals that we profess. For the last year and a half of my life, I've been not only a doctor, but also a patient. A lumbar disc rupture led to incapacitating pain, followed by a spine surgery a year ago, followed by a second spine surgery about 5 weeks ago. Despite these interventions, the daily debilitating pain continues. I can only sit or stand for an hour or so before I have to lie down to relieve the pain. I don't know whether this injury will ever be fixed, and I doubt that my life is ever going to completely go back to the way it was before the injury. Naturally, I wouldn't wish this kind of thing on even my worst enemy, but I will say that it's not a bad thing for physicians from time to time to be on the receiving end of medical care. You see things differently, you gain a different perspective when you're lying on the examination table. Now, in the past year, I've seen rehab docs, pain docs, 4 spine surgeons, all of them good, though none of them entirely successful with my case. I know that the next doctor may not be able to fix the problem. But I do hope that he or she will relentlessly pursue answers with me. And before we embarked on this project of trying to find a solution, I need the physician to acknowledge the implications of the disease, what it means for my life. One of the most consoling physician encounters I've had during this time took only a moment. It was so subtle that most people probably wouldn't have noticed. I was seeing a top-flight spine surgeon here at UCI. After looking at the MRI of my original injury and nerve compression, he paused for just a few seconds before launching into his assessment and recommendations. He took just a moment to acknowledge the severity of my pain, to sit with it, without immediately trying to jump in and fix it. As it turned out, he couldn't fix it, but that was okay. In that moment of acknowledgement and recognition, his humanity shined through. A physician's knowledge and technical competence are necessary but never sufficient. In the famous words of Sir Francis Peabody, the secret to the care of the patient is in caring for the patient. It's disarmingly simple, and yet often difficult, especially when you're overworked or stressed or fatigued, to really forget about yourself and give yourself generously to that patient in front of you. I recall surgery rounds with Dr. Katz at Georgetown as a 4th-year medical student. She'd been grilling us all morning with questions, virtually none of which anyone answered correctly. In a pleasant mood that day, she decided to poke fun at us rather than berate us. "Where ignorance is bliss," she said, waiting for us to finish the line. "Where ignorance is bliss," she said, but we stood by dumbly. "What's the rest of the line?" she asked, annoyed at our ignorance not only of surgery, but also of poetry. Now, a piece of advice: if you don't know the answer to an attending's question, you should look it up. So that night, I dutifully did an online search for "Where Ignorance is Bliss," and I found the poem. The next day during rounds, I triumphantly announced, "Where ignorance is bliss, 'tis folly to be wise." Matt Gray, 18th century American poet. And then Dr. Katz smiled at me, I think for the first time. With my confidence bolstered by this small victory, I continued, "But But I thought of a better line of poetry to describe this rotation. It comes from Robert Frost. She asked me what it was. And miles to go before I sleep, and miles to go before I sleep, I said, thinking myself quite witty. It was true. The long hours on this rotation were grueling for everyone. But then, Dr. Katz became more serious. Just remember, she said, no matter how long you stay here, you eventually get to go home. But the patients don't get to go home. They're still stuck here. Yes, the resident said, nodding her head. It's no fun being sick. Thinking only of my own discomfort, I'd forgotten the most obvious fact. I'd lost sight of the patients. Yes, I was tired. Yes, I was feeling overworked. We all were. But by comparison, this was trivial. It's no fun being sick. Our society still views the physician as a kind of authority figure, as someone who can confidently administer the right solutions for serious problems. But through hard experience, the physician knows that this is often an idealized fantasy. We don't always have the answers. We must learn to live with uncertainty and with our limitations. Like every medical student, every physician struggles from time to time with doubts. What if I'm not up to the task? What if the patient doesn't respond? What if I make a mistake that harms my patient? We naturally want to help people. That's why all of you are here. But we also need to learn to live with the cases that do not go as we hope. You will experience time and again the joy of healing the sick, and this is tremendously rewarding. But you will also experience the sorrow of watching someone that you've cared for grow worse and even die in spite of your best efforts. Indeed, the fact of death is inescapable in this. Despite all of our amazing medical advances, the human mortality rate continues to hold steady at 100%. So, in medicine, specific outcomes are never guaranteed. But it's this courage to continue our work day in and day out, even without the promise of success, that characterizes good physicians. In all this, we need to remember that there are incurable conditions, but never untreatable patients. We continue to care for the sick, even when cure is no longer possible. I recall my transplant surgery rotation as a third-year medical student. During this rotation, I did witness incredible medical triumphs, true miracles of healing. But those were the easy cases. One day on transplant rounds with Dr. Smith, we entered the room of a dying patient. She had, among other medical problems, severe liver disease. The family was begging Dr. Smith to do a liver transplant. He politely but firmly refused, explaining that the patient's heart would not be able to handle the operation and that surgery would likely kill her. The family replied that she would die anyway without the operation. They had a point. The family then insisted that he explain her odds of surviving the surgery. And Dr. Smith told them it was less than 10%. Well, they replied, that's better than her odds without the operation, which are 0. We're willing to take the chance. Again, they had a point. What Dr. Smith knew, but did not want to say, was that the transplant team could not use the precious liver on a patient who would most likely not survive. A transplantable liver is a rare resource, so the recipient is very carefully selected. This patient's family, quite understandably, cared nothing about this problem of distributing a rare resource. They saw only that they were losing a loved one. So the conversation continued around for several more minutes. Finally, unable to make headway, Dr. Smith left the room and closed the door. I can still remember his face as he turned to me and said with a sigh, "No one ever said this job was easy." My friends, nobody ever said this job was easy. But that's why you're here, isn't it? You have not chosen a cushy or a comfortable career. You have not chosen the path of least resistance. But you have chosen something very worthwhile. If you'll permit me just a couple of parting words of advice. From now until you retire, do not stop cultivating and reviewing your medical knowledge. We make progress by a continual critique of what we've already learned. At the same time, keep in mind that knowledge alone is not enough. It's not science, but love and devotion that transforms our world. You'll alleviate pain and distress not only with a well-chosen prescription, but also with a word of encouragement and compassion. Try to cultivate and maintain a breadth of interest, even in medical school, even when you're very, very busy. All of your human passions and pursuits can be relevant to professional work. After all, physicians are not robots who treat diseases, right? Or people who treat other people. In your clinical practice, attend with particular devotion to the lonely patient, to the abandoned patient, to the patient who suffers not only physical deprivations, but human deprivations as well. In your work, always, always follow the light of your conscience, even if your decisions may be unpopular. Guard against professional envy. Instead, focus your energies on serving your patients and on assisting your colleagues. This will be success enough. My friends, I have great hope for our profession. All of you bring, as has already been said, exceptional personal gifts to this work. The students that I meet here continue to inspire me. The future of the medical profession is bright, not because we have a perfect healthcare system, which we don't, and not because we have amazing advances in medicine, which we do. The future is bright because every year we have exceptional men and women who come to medical school and who take the plunge. As Dr. Peterson reminded you, always remember to thank those who are here with you, your family and your friends, the people without whom you would not have made it here. And be absolutely convinced that you are here for a great and noble purpose. Not one of you landed here by accident. Being a physician is a way of life, not just a livelihood. It's a vocation and not just a career. What's the difference, you might ask? Here's the best that I can explain it, and I'll close with this. 4 years from now, when the dean hands you your medical degree, consider this. You are a physician, not because you went to medical school. Rather, you went to medical school because you are a physician. Thank you for your attention.